this, part of a call with the president, his team, and governors from across the country.
Literally, we are one day away, if we don't get test kits from the CDC, that we wouldn't be able to do testing in Montana.
Tony, you can answer it if you want, but I haven't heard about testing in weeks. We've tested more now than any nation in the world. We've got these great tests, and we come out with another one tomorrow where it's, almost instantaneous testing. But I haven't heard about testing being a problem.
Katie Talento is with me. She is an infectious disease epidemiologist and formerly a Trump advisor on health policy. Katie, I'm so glad you're here. Thanks for the time.
Thank you for having me, Poppy.
We also just heard this morning on New Day from Maryland Republican Governor Larry Hogan. Here's what he said.
There's no question that the federal government and all of the states believe that we need more testing. Without the tests, we really are flying blind.
The president says he hasn't heard anything about testing in weeks, but multiple governors, I've just named two, there are many more, don't have enough tests. Is the country flying blind without enough?
I think we all want to see more tests happen. I think that's absolutely a priority. Probably what the president was saying was that he hadn't heard that there was as great a need in a few weeks because everybody's been working so hard on getting it out. And that's the point of having these calls with governors, is to hear from them. So, what we heard last night from Secretary Alex Azar and from the president is that we've got 1 million tests now that have gone out. And most importantly, we have this new Abbott Labs test. It's a rapid test that will give us a yes answer in 5 minutes and a no answer in under 15. So that's going to help. They're going to ship 50,000 a day. And that's ramping up right now, starting today.
I was just going to ask you about that. I think that's a really positive development that the FDA has approved that Abbott Lab test. And we saw what a difference that makes with flu, right, and being able to test for the flu so quickly. So we'll watch for that. Let's talk about masks. The president said yesterday we could get to a point where all Americans are advised to wear masks. But as of this morning, CDC and WHO aren't saying at this point that that is what Americans should be doing. What should we all do when we leave our house?
Well, we shouldn't leave our house. That, I think, is the first thing to remember, is that we don't know yet if masks really work. We don't have the evidence base for it. We absolutely have centuries of evidence about social distancing. So what I'm doing to protect myself and my family is I'm leaning in to those stay-at-home orders. But there are essential workers and there are first responders that have to go out. I think that it's really important that if you wear a mask, you don't do anything different with respect to staying away from other people that you would if you weren't wearing a mask. Either way, we need to really be disciplined out in public.
What do you think we have learned? What is the lesson learned from this crisis in terms of the ability to save more lives next time something like this hits, in terms of testing and what we use? For example, the administration, the CDC, not allowing and not using the WHO test that was developed, also banning private hospitals from utilizing tests that they had developed. Was that a mistake that can direct us in the right direction next time?
So I think there will be time after this is all over for postmortems and assessments of blame and assessments of what went wrong. Right now, we have to stay focused on going forward. We can't have our experts diverted into analyzing the past. I do think that we will see that testing, rapid testing, should be an absolute priority. I think we should open wide the floodgates to tests being developed from all sources. But of course, our FDA and our CDC officials, they're really worried, and it's their job to be worried about false results. If you get a bunch of false positives or, God forbid, false negatives, that creates a problem. And the American people come to we're going to have tests that are reliable and valid. And so there's a trade-off. I think these times are really important for analyzing the trade-offs between security and scientific validity, but also rapidity and how quickly we can ramp up and scale up and see the lessons of the future.
Look, I think we all know as humans that failures are what we all learn the most from. And that's where that question comes from. as well as this, as someone who advised the president and his team on health issues and who has the background that you have, what do you think the impact has been of the president for weeks until recently downplaying the magnitude of this pandemic and saying things like just in mid-March when he said it's something that nobody expected, when we now know there was this 69-page briefing book put together by the NSC that played out what happens in a pandemic and asked questions like, quote, is there sufficient personal protective equipment for healthcare workers who are providing medical care? I ask this for all the doctors out there, like the ones in Brownsville, in Brooklyn, who told us yesterday they are going to Home Depot, some of them, to buy protective gear. That guidance in 2016 was not taken by the administration. What can we learn from it going forward?
Well, I think the president isn't always briefed on every single preparedness activity that's going on at the staff level. And I'm actually encouraged that those plans and those conversations were going on. I know that the global health team, both
But they didn't heed the advice. And the president saying no one thought anything like this could happen, but they did. A lot of people thought this could happen.
A lot of people in the White House and at all the agencies, of course, did think something like this could happen. The fact that there is a briefing book shows you that everyone was thinking about this. Just 6 months prior to this event, the president signed an executive order on pandemic flu preparedness.
But Katie, why? My question is, it's great to have a briefing book, but if it is not utilized, and if there are doctors dying right now and nurses dying right now and first responders without the proper gear, I'm asking what lessons can be learned and applied for the future?
It's a good question. I think that probably one of the most important lessons is the role of our state partners. I will say that the states are an integral, essential part of our pandemic preparedness efforts over the past years and years. And those essential partners really have the freedom to stockpile things for their own people and not be at the mercy of the federal government.
So the states shouldn't rely on the national stockpile? The states shouldn't be asking the federal government now?
I don't think any governor wants to be in a position where they're at the mercy of federal decision makers who have to look out for the entire country. I think every governor, the system that we have was designed so that governors wouldn't have to be in that position. And any state or governor that's sort of pointing the finger at the federal government's lack of preparedness and any supply shortage is at least equally exposing that state's lack of preparedness. I think you asked the question about what the lesson is going forward. It's that we need to be prepared at the state level and local levels as well as the federal, and there is a lot of room for improvement at all levels.
Katie Talento, appreciate you coming on, and come back, please. Thanks for your time.
Thank you so much.
Okay, Jim.
North America's largest convention center is about to